Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. And today's video is going to be on blood sugar and how it affects the adrenal glands. Now this is huge. These two combined are a very, very common problem in our society. This is very important. It's probably one of the most important videos you may watch. So if your blood sugar is off, and if you want to learn how that happens, go back and watch the previous videos. If your blood sugar is off and if it is causing an inflammatory response in the body, if it's causing this dysglycemic effect, it becomes a stressor. Okay, and we all know about emotional stress. We know that if we're stressed out, we feel like our fight or flight response kicks in. But what most people don't realize is that there are metabolic stressors as well. There are environmental stressors. There's all these different stressors that can affect the adrenal glands. Blood sugar is a major effect on the adrenal glands. And what happens is when blood sugar, so basic function for the adrenal glands is the fight or flight system. So if you're in the woods, you see a bear, the bear starts to attack or chase after you. A part of the brain called the hypothalamus will recognize the threat. It'll send a signal to the pituitary gland, which will then send a signal to the adrenals, and the adrenals will release all the adrenal hormones, cortisol, epinephrine, norepinephrine, and so on. So when this happens, when that initial response happens, epinephrine, norepinephrine, those are the quick responders. They go up quickly and they go down quickly. And then shortly thereafter, cortisol is released and it degrades more slowly. So that provides us with that longer response. So you're running from the bear, or you fight the bear, you climb a tree. Well, don't climb a tree with a bear, but whatever you do to survive that situation, there's a physical response. You burn off these hormones, things go back to normal. So the adrenal glands are fine. Now, if you have the dysglycemia that we talked about in the previous videos, again, if you don't understand this, please go back and watch those. But if you're having this dysglycemic effect, okay, when blood sugar goes up, it puts stress on the adrenal glands and it pulls cortisol up with it. When blood sugar comes down, it suppresses adrenal function. So it's this constant up and down. So the hypothalamus is picking up on these hormone levels and what's going on with them, and it starts getting confused. It starts getting dysregulated. So what will end up happening is, instead of having this one quick response followed by this slow cortisol response, you'll have multiple quick responses with your epinephrine and your norepinephrine, and you'll have multiple cortisol responses. So your cortisol actually never gets to go down. So the cortisol starts going too high and the adrenals end up consistently working. They're going up and down, but these responses are happening frequently. So what can happen with that, eventually the hypothalamus can lose its regulatory effect, or you can have negative pituitary effect, or the adrenal glands may become fatigued. And when they become fatigued, you get into adrenal fatigue. So all of this can happen because of that blood sugar dysregulation. So everybody always thinks that adrenal dysfunction and adrenal fatigue happens because of emotional stress, and yes, that's true. But it also happens because of metabolic stress, and these two occur very, very commonly. They're commonly seen in most of the patients that we see who have Hashimoto's or low thyroid function, or obviously diabetes or hypoglycemia, or adrenal fatigue patients. All these different conditions, chronic fatigue, fibromyalgia, all these chronic conditions that people can't recover from and they're taking medications for, that's not addressing the cause. We commonly see this with patients. So this is critical. This has to be fixed. If a patient is dealing with these issues, this has to be fixed before you even go in to fix the other things that we're going to talk about in these videos. This is a deal breaker right here. All right? Any questions, please feel free to post below. Any topics you'd like me to cover in future videos, please feel free to post those below, and I look forward to hearing from you.